So provisions 6.3, responsibility for healthcare environment. The nurse's responsibility. So the nurses are responsible for contributing to an environment that demands respectful interactions among colleagues, mutual peer support, and open identification of difficult issues that may have potential ethical implications. Advocating for ethical work. So, rectifying unsafe or inappropriate practices requires persistent collective efforts. As organizational change is challenging, nurses should advocate for institutional recognition of problems and engaging in collaborative, interprofessional efforts to strengthen ethical environments. Collective action. So, nurses are responsible for addressing these concerns about unsafe or unethical healthcare environments through appropriate organizational and regulatory channels. So, if there's nurses to nurses advocating where they can go, maybe their own nurse HR, they can go to them. If repeated efforts fail and nurses are forced to compromise patients' rights, standards of practice, or personal integrity, they may face a difficult decision to resign despite potential financial or professional risk. Remaining in these kinds of environments can make nurses very complicit to the unethical practices around them. Sometimes they just give in if they see that there's no way out or if no one's paying attention. And this can cause personal and professional harm, but they should continue to advocate for improvement if they stay. Collective action, such as bargaining, voting, or striking, can be a powerful way to confront unjust practices, with nurse-led entities playing a key role in representation. So we can have, your nurse director out there with you or the nurse manager from the hospital. After collective action or resignation, intentional efforts are needed to rebuild the ethical environment and restore trust among colleagues, institutions, and the community. Nurses creating ethical environment is built on civility, kindness, dignity, and respect while working together to provide compassionate and effective care through advocacy, solidarity, and collaboration with professional organizations. They promote safe practices, environments, and welfare of nurses. Nursing organizations further support this by advancing legislation, upholding standards and the code of ethics, and responding to changes in healthcare and society.